Hi, my name is Alice Sunisianu, and I work in infection prevention and control at the World Health Organization. Welcome to Module 2. This one goes into the novel coronavirus, or COVID-19, and its epidemiology, risk factors, definitions, and symptomology. Let's begin. The learning objectives for this module are to describe the current epidemiological situation, including case definitions and signs and symptoms. So what is a novel coronavirus? Coronaviruses are a large family of viruses that cause a wide range of illness, from the common cold to more severe diseases, as we've seen in the Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. A novel coronavirus is a new strain that has not been previously identified and has reached humans. On December 31, 2019, the WHO China Country Office was informed of several pneumonia cases of unknown etiology in Wuhan City in the Hubei province of China. A novel coronavirus was isolated and later identified as the causative virus by Chinese authorities later in January. As of February 23rd, these were the countries affected by the coronavirus. So what we currently know about COVID-19 is that the incubation period ranges from 1 to 12.5 days, with a median of about 5 to 6 days. Although these estimates will be refined as more data becomes available. More information is needed to determine whether transmission can occur from asymptomatic individuals or during the incubation period when they are pre-symptomatic. We currently know that the modes of transmission are through droplets sprayed by affected individuals or through contact with patient respiratory secretions or contaminated surfaces and equipment. Although we do not know the extent of these transmissions, we also know that there has been transmission from animals and humans to humans in the community. Currently, there is no available treatment for COVID-19 or vaccination, although one is hopefully due to arrive in the next year or year and a half. Thus, we recommend supportive measures only. What are the signs and symptoms of illness? So far, we know that the illness seems to start with a fever, followed by a cough, and then followed by shortness of breath, and some other respiratory symptoms like runny nose, weakness or malaise, nausea, vomiting, diarrhea, or headaches. Some patients also advance to other stages of illness, where they develop pneumonia, bronchitis, sepsis, and can even lead to death. What are the case definitions so far? Well, as of February 4th, we recommend the following patients to be investigated and tested for COVID-19. So those are patients that present with a history of fever, cough, and require admission to the hospital, with no other etiology that fully explains the clinical presentation, and have a history of travel or residence in China in the previous 14 days prior to symptom onset. Or patients may present with acute respiratory illness and at least one of the following during the 14 days prior to symptom onset. Either contact with a confirmed or suspected case of COVID, or have attended a healthcare facility and cared for COVID-19 patients. So this is the end of Module 2. Thank you for listening. You can now continue to Module 3, where we will be describing the recommended IPC measures when dealing with a suspect or confirmed COVID case.